Once you figure out the function of the behavior, or why the child does what they do, you're equipped to teach a replacement behavior. Replacement behaviors are functional communication responses that meet the child's needs or function appropriately. This is also referred to as functional communication training. So, for example, if a child is hitting his mom for attention, then a better replacement behavior might be to teach him to say, "Mom," or tap her arm if he is not vocal. There are many different response methods a child can use. Functional communication training, or FCT for short, is an evidence-based intervention for people of all ages. FCT was introduced in the 1980s. FCT teaches the person how to use appropriate communicative behaviors to meet their needs instead of using problem behaviors such as crying, screaming, biting, hitting, and throwing temper tantrums. In other words, you're teaching your child to use a more appropriate and efficient communication response instead of the problem behavior. Examples may be teaching your child to ask for what they need instead of crying, or asking for a break when they feel overwhelmed. Children need to learn how to communicate in a way that will meet their needs. Children with communication challenges are likely to exhibit problematic behaviors such as crying or tantrums if they're not provided with a way to communicate their needs. Suppose children do not have a way to communicate. In that case, they may display other behavior challenges like bullying, academic complications, and internalized behaviors such as anxiety. A word of caution for all families. Before using FCT, it's always important to rule out any medical concerns or causes of the problem behavior with a medical professional. For example, does the student have any unknown hearing or vision issues, such as an ear infection, that may contribute to their problem behavior? All children are unique and will work best with a certain method. The correct functional communication method will be determined through considering the child's skills, vision, mobility, scanning, problem solving, planning, and sequencing. Medical concerns are also considered, such as considering if the child has the respiratory ability to pronounce words. Please consider working with a consultant or a specialist to make the correct decision for your child. Functional communication methods include using gestures like pointing or nodding, sign language, visuals, low, medium, and high-tech grid systems, and vocalizations. Using visuals and the grid systems all require knowing the meaning for symbols and using the symbols to communicate needs. As is stated here, the systems run from simple visuals like yes and no cards, low-tech to high-tech. As previously stated, all children are different, and different systems will work best for each child. This decision often requires an evaluation from a specialist, such as a speech and language therapist. Keep in mind that your child's functional communication response must be easy to learn and easy for others to understand and notice. Suppose the FCT response is more challenging to use than the problem behavior. The FCT response must be easy for many people to know so the child gets what they need. Or the child uses the method, but people need to understand what the child is requesting or needs. If the child's needs are not met, they'll be less likely to change communication methods. To determine the best FCT communication method for your child, consider your child's abilities and skills. These skills may include developmental ability, hearing, vision, movement, language, literacy, vocal, planning, and problem solving. Make sure the FCT method will meet your child's needs. Think about your child's needs and how hard or easy it will be to teach them the new way. Ensure your child has all the skills needed to use the FCT response. Consider how other students and educators respond to the child's new communication response. Will communication allow the child to get what they need across all settings and multiple people? Lastly, choose the communication method for your child. As mentioned before, all children have different skills. Make sure your child has the skills required for each FCT method. Next, let's look at a couple of examples and determine the best FCT method for the children. Baby Susie cries and screams when her mom walks away. Her abilities and skills are planning, vision, mobility, problem solving, and language. She cannot yet sequence. The function of Susie's behavior is to get attention from her mom. Susie's mom can teach Susie to gesture or make signs. These will have to be easy to learn and understood by the critical people in Susie's life, including her dad, grandma, sister, and her mom. Susie's mom decides to teach baby Susie how to sign hug as a way for her to request attention. Paul's situation is a little more challenging because Paul must take his medicine. Paul wants to escape from taking the medication. Paul's dad decided to teach Paul to ask for 1 minute before taking his medicine. This way, Paul can prepare himself rather than just getting the medication forced on him unknowingly. Paul's dad knew that Paul could plan and use vision, mobility, problem solving, and language. Paul's dad decided to use a break card that asked for 1 minute. Every time Paul showed the card, Dad would wait 1 minute before giving him the medication. Then, Paul would take the medicine after 1 minute had passed. Maria throws tantrums in the store to gain a snack. Her abilities and skills are planning, vision, mobility, problem solving, scanning, sequencing, and language. The function of her behavior is to gain access to food items. Maria's mom teaches her to use a low-tech grid system to request items at the store. This is a regular-sized piece of paper with 6 symbols on it. The symbols stand for bathroom, food, drink, toy, play, and hug. Whenever Maria uses the low-tech grid, Mom will give Maria what she requests. When Maria looks at the food, Maria's mom knows that Maria is hungry and gives her food. Associated with this lesson is a sheet for you to complete for your child. This is used to direct you to the correct functional communication training method. As we've discussed, FCT begins with finding out why the child does the behavior, also known as the function of the behavior. Now, let's learn how to teach the FCT response. The environment in which you teach your child to perform the response is essential. This is because you want to ensure your child has enough opportunities to practice the new skill. You can instruct your child in the everyday or natural setting. Consider the case study of baby Susie. Mom could only teach Susie to sign for attention when she put her down for a nap or for the night. These teaching opportunities occur at natural times. Another option is to set up opportunities for the child to practice the FCT response. These are called artificial practice opportunities because they only occur occasionally in the child's life. For the case study, Maria and Mom could intentionally walk down the store's candy aisle multiple times per day. This is not natural because Mom typically only goes down this aisle once a week. This does give Maria many opportunities to practice using her card to make requests. Let's examine the positives and negatives of using natural or planned practice opportunities. Teaching functional communication through natural and artificial practice depends on parent preference and how strong or challenging the behavior is. Consider the case study of Paul. He doesn't want to take his medication, but must stay healthy. Paul's dad decides that waiting 1 minute before taking medicine is okay, but he cannot go longer than a minute. Paul must take his medication so he's not sick. Paul cannot practice using the card at artificial times because taking extra medicine isn't good. Paul must practice using his functional communication response during natural times. Another child may have hazardous behaviors. For example, a child may bang their head on a wall whenever they hear somebody cough. We wouldn't want to use artificial practice opportunities because we'd put the child in a position to hurt themselves. Now let's think about a child learning to brush their teeth. Every time the child is asked to brush their teeth, the child tantrums, and the mother says they don't need to brush their teeth and must go to bed. The function of the tantrum is to escape from teeth brushing. This mom decides to use a break card to help her child. She must decide between practicing FCT during artificial or natural, such as morning and night. Waiting for actual times only twice per day will decrease learning opportunities. Mom chooses to use fake times to practice FCT with teeth brushing. The child now brushes their teeth morning and night and a few times throughout the day. Parents can use prompting to help their kids complete the FCT response. There are many ways to use prompting. Some methods are more intrusive than others. The level of prompt you use depends on what your child needs. In addition to learning the level of prompts to use with your child, you'll also learn how to reduce the prompt so your child can become more independent. Consider the prompting hierarchy so you know how to best support your learner. Let's look at the prompt hierarchy from the most intrusive level prompt to the least intrusive prompt. Full physical prompts are when you physically move your learner's body to perform the correct response. An example could be moving a child's hand to teach them to sign a word. A partial physical prompt is not as intrusive because you only slightly touch the learner's arm, elbow, or hand to get them to perform the required response. A model prompt shows your learner what you want them to do. For example, if you wish your learner to touch a button on a medium tech device, model the behavior by touching the button. Then allow time for your child to respond. Next is the gesture prompt. With a gesture prompt, you'll indicate what you want the learner to do by looking at, pointing to, or nodding to the correct response. For example, if you want your learner to touch a break card, you can look at the break card. This should cue your child to attend to the break card and use it in the required manner. Lastly, there are vocal prompts. These prompts are self-explanatory and require you to use your words and tell your child the response you'd like them to perform. Your prompt will be short and straightforward. For example, if I want my child to request a break by touching the break card, I'll tell them, touch break. Starting with the highest levels of prompting and moving towards less intrusive prompts in time may result in fewer problem behaviors. Behavior is reduced because you do not allow the child to perform it. Consider Ben, who injures himself to get attention. Ben's mom wants to teach Ben to request attention without hurting himself. Before Ben can hurt himself, Ben's mom quickly uses a high-level prompt. She puts the attention icon in Ben's hand and automatically gives Ben attention. She does not allow Ben to hurt himself, and she can still teach him to use FCT. We want to reduce the level of prompting we give our youth so they can learn to be self-sufficient. Reduce prompt levels only when the child has mastered their current prompt. For example, Ben's mom uses a full physical prompt and puts the icon into his hand before he can hurt himself. If mom moved to a lower level prompt, such as partial physical, and only touched Ben's hand, Ben would not know what to do. Ben might hurt himself to gain attention because the prompt was reduced too quickly. If mom waits until Ben has mastered full physical, she can more easily move to partial physical prompting with less fear that Ben will hurt himself. Once your child masters a more intrusive prompt, reduce the prompt level. For example, move to visual cues once the child is successful at gesture prompt. The prompts used will depend on the individual child and situation. You can use only some prompts and skip some levels depending on your child's needs. You'll use the prompt that meets your child's needs and most to least prompting.